Do you have elbow pain over this area? How do you know that the elbow pain that you have is due to tendinitis or inflammation of the tendon, or what we call tennis elbow, or it's due to a nerve problem such as radiculopathy or pinched nerve in the neck? As the nerve root C6 and C7 supplies the elbow and supplies this area, muscles and skin. So you can have elbow pain from inflammation of the tendon, or you can have elbow pain from a pinched nerve in the neck or in the arm. Now, it is important to differentiate between the two entities and the cause of the elbow pain, because the treatment is different. Now, some people might have both. They might have tendinitis or inflammation of the tendon and radiculopathy, a pinched nerve in the neck at the same time. The reason? The C6 and C7 nerve roots exit the neck and supply the elbow and supply the forearm. So when you have a pinched nerve in the neck, you're going to have weakness of those muscles. With weakness of those muscles, that's going to cause abnormal muscle function, and therefore it can result into tendinitis or inflammation of the tendon. So you will have both entities at the same time. A radiculopathy causing a nerve pain, and tendinopathy causing an elbow pain from the inflammation of the tendon. Now, it is crucial for the patient and for the physician to differentiate between the two and to differentiate the cause of the elbow pain, because the treatment is different if it is tendinitis or if it is radiculopathy or a nerve problem. Now, how do you know as a patient? How can you tell that the problem that you're having is a tendon problem, or if it is a nerve problem, or if it is both? Now, a tendon problem, or what we call tennis elbow or tendinitis or lateral epicondylitis, typically it happens from repetitive movement of the tendon or the muscle, or wrong use of the nerve, of the tendon or the muscle. Typically we see it in painters, we see it in tennis players, we see it in people who are using their arm in this movement. So that causes inflammation of the tendon, and therefore they will have an elbow pain. Typically the elbow pain is localized to the elbow. At times it might extend a little bit below or above, but does not extend to the length of the arm. Now, if you have, and also the pain is a lot worse with movement, with action movement of the elbow, and it gets better at night time. Now, if you have a elbow pain that is due to a nerve problem, such as radiculopathy from a disc pushing on the C6, C7 nerve root, then you're going to have pain in the elbow. The pain might extend all the way down to the fingers. It can go up. You will have, or you might have, numbness and tingling sensation of the forearm or those three fingers. You might have weakness of those muscles. Typically it's bilateral. Unlike the tendinitis, it's usually one side, the arm, that you use excessively. Now, also at times you might have neck pain if your problem is coming from the neck. Now, how do we confirm it? The physician will confirm it for you. The physician will rely on the history of the symptoms, what you do for a living. If you have repetitive movement of the arm, then it's most likely a tendon problem. If you don't, then most likely a neck problem. Then we do the physical examination. With tendon problem, you have severe tenderness over the elbow, over the tendon area. The tenderness will worsen with movement of the muscle or the tendon. Now, if you have a nerve problem, you might have sensory deficit, decreased pinprick, light touch over the nerve distribution and over those fingers. You might have weakness of the extension of the wrist or movement of the elbow. You might have also neck pain and neck tenderness, neck limitation of the neck movement. The reflexes might be reduced. Now, to confirm the diagnosis, then the physician might order further testing, including a nerve conduction test and EMG, which will confirm if the patient has a impingement of the nerve at any level, at the level of the neck or below. Now, if he or she is suspecting a disc problem, then order an MRI of the cervical spine or the neck, and that will confirm the disc pushing on the nerve root. But we have to confirm the diagnosis and the etiology and the cause of the elbow pain before we prescribe treatment. Because if you treat an elbow problem as tendinitis and it's a neck problem, most likely you're gonna not succeed in treating the problem. And now the treatment depending on the cause, so we identify the cause. Typically we start with conservative therapy. If it's a neck problem or a tendon problem, we can treat them both at the same time. For the tendon problem or the neck problem, we might use NSAIDs, anti-inflammatories, such as ibuprofen, naproxen, diclofenac. Now, if you have a neck problem, you might add a muscle relaxant. Then you might order physical therapy for both or one of them. You will order the physical therapy based on the pathology. Now, if conservative therapy does not work, then we move to intervention. I usually use injection of a platelet-rich plasma in the tendon. If it's a tendon problem, we might inject it in the neck. If you have a disc problem, you might use decompression therapy. As a last resort, then you go for surgical intervention if everything fails. However, I will have 100% confirmed diagnosis before I order a surgical intervention, because the surgery is going to be either at the level of the tendon or it's going to be at the level of the neck. So it is important to have the confirmed diagnosis before you go for surgery. So again, you can have elbow pain. The elbow pain can be due to tendinopathy or inflammation of the tendon, can be due to radiculopathy, a nerve problem, or it can be due to both. So it is important to differentiate between the two as a patient, to confirm the diagnosis by the physician before you undergo a treatment. Thank you.